So that Umbreon is full health. Good. Oh, hello there. Welcome to the Pokémon Center, where we restore all Pokémon to full health. I'm Nurse Joy. I've been expecting you, little Psyduck. Your trainer says that you had quite a battle earlier today. Is that true? I see. She said you've also been experiencing some very severe headaches lately. I'm sorry to hear that. Do you know if there's any particular cause to them? Your trainer. That's right. Severe headaches, that's what activates your psychic attacks, right? I see. I suppose that is one of the drawbacks to a Psyduck. I wish that you didn't have to be in pain to be at your most powerful. Well, not to worry. We will get you fully restored to health. We can take care of any sort of damage you may have received during your battle. And of course, we'll heal your headache too, alright? Now, would you like to go into your Pokeball today, or would you like me to do things the old-fashioned way? Of course, not to worry. Sometimes it's nice to have a little bit of personalized attention, isn't it? Of course. Well, if you don't mind then, I'll start out by just getting a good scan of you. We'll find out what sort of damage you may have taken in the battle, and then we'll assess what needs to be fixed, alright? Okay. I have a little device here that's just going to scan you, okay? It's going to have a red light that I'm just going to pass in front of you. And it will make a little bit of a vibrating noise, but it shouldn't be too loud, alright? I just don't want to disturb you. Okay. Alright, now try and hold nice and still, okay? Good. Now, the other way here. Good. All right. Could you hold out your little wings for me, please? Good. Just like that. Excellent. All right. Just one more time, all right? Just keep holding nice and still. You're doing a wonderful job so far. Good, good. Thank you. Now let me just send those to my computer over here, all right? That will just let me know how you are doing. Okay, definitely lost some hit points in the battle. That's alright, perfectly normal. We have plenty of different items that can help to restore your hit points. Looks like perhaps a little bit of burn damage too. Were you fighting a fire type today? Ah, I see. I've heard that they are very strong, but your trainer did say that you won today. Congratulations. Not to worry, we'll take care of the burn damage as well. Now, this scan doesn't necessarily show things like a headache, but I have quite a few different items that we can use to try to soothe that headache too, alright? Okay, let me just put on a pair of gloves and then we'll get started. There we go. don't mind, I'd like to look at your arm where the burn damage was first, okay? On your wing here. Can I lift up your wing? Thank you. Don't worry, I won't touch the actual burn. I just want to see. Okay. Well, there's definitely some damage there, but it doesn't look like it's too severe, which is very good. You must have partially dodged their attack, I think. Yeah, good. Alright, well, let me get my burn healer here. This is just a little spray that will help to soothe that burning. Have you seen these before? Does your trainer have some of these? Good. All right. Now, if you could hold out your wing for me, please. Thank you. There we go. Does that feel okay? Good. Yes, it should have a very soothing effect, almost instantly, really. Good. Just a little more. There. How does that feel now? Wonderful. Oh, I'm so glad. Good, good, good. Well, I think that does it for the burn damage, which is very good. Now, what do you say we get your hit points filled up, shall we? Good, good, good. All right. Got here a hyper potion. This should be all that you need for your hit points today. So I'm just going to spray this on you, and it will restore you to full health. Alright. You can close your eyes if you'd like, but I'll be careful not to get it in your eyes too. Okay. Here we go. Good. Good. There. There we go. Look at my scans here. Yeah, maybe just a little bit more. There we go. There. I think that should just about do it. It's a relatively simple process. There we go. I'd like to just scan you one more time, just to make sure that you are fully healed and that there aren't any other damaged areas that we missed the first time, alright? Alright, just hold still for me again. Good. Now hold out your wings for me again. Thank you. Good. Right, send those here. Ah, excellent. I think you've been all healed, except for that headache of yours. I'm sorry to hear that you have a bad headache, but as I said, I've got different things that can help with that too, alright? Okay. Let's see. if you don't mind, I'd like to start out just taking a little bit of a look in your eyes and your ears, just to make sure there isn't some sort of underlying problem, okay? Now, does this headache cause sensitivity to light? Okay, well, if at any point the light gets too intense, just let me know and we'll work with something else, okay? But here's my light. Is that too bright or is that okay? Alright, so to start out, I would just like you to look over here at this side. I'm going to bring the light over here, okay? But just look over here at my fingers. Okay. Alright, and now look over here at these fingers, okay? Okay. Good. Pupil dilation looks like it's alright. Have you noticed any soreness in the eyes? Tiredness, irritation, puffiness? Okay, yeah, I don't see any indication of that, but just good to know. Alright, now I'm going to bring the light into your vision, and I would like you to follow it with your eyes only, okay? Can you do that for me? Alright, do the best that you can. Just follow the light here. Just follow the light with your eyes, alright? Good. Good, good, good. Well done, little one. You're doing an excellent job. If I move it back here, and closer up, and back, and closer up. Good. Well done, little Psyduck. Alright. Now, I'd like you to look at my nose. Keep your eyes on my nose, but I'm going to bring the light into your peripheral vision, alright? The outsides of your vision. And I just want you to tell me when you see the light, okay? Alright, so go ahead and look right here. Tell me once you can see the light. Good. Good. Keep looking at my nose. Alright. Good. 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 Keep looking right here. Good. Good. Well done. I'm not seeing any issues with your vision as of now, so that's very good. Good that we don't have any sort of underlying causes, alright? Now, I would also just like to take a little peek into each of your ears, okay? With this little device here. Is that alright with you? Okay. You don't have to do anything, just hold nice and still if you can, okay? Alright. Just want to take a peek here, make sure there isn't any sort of ear infection, redness. When I press here, does that cause any discomfort? Alright, good, good. Alright. I don't see any cause for alarm in that ear. I'll take a look in this one too, okay? Just hold nice and still for me. Alright, when I press here, does that hurt at all? Alright, good. Not seeing any signs of redness, inflammation, tenderness, anything that would indicate an ear infection. Alright. Good. I just wanted to rule those out so that we know that there's not any sort of underlying more serious issues. You said that your trainer gave you this headache, right? Does she typically do that? Well, I suppose some trainers have interesting techniques on how to win battles. Well, then perhaps I should just feel around on your head and see if I can feel a bump. Is that alright if I gently touch your head? Okay. Just very gently here. Let me know if there's any area that feels more tender to the touch, okay? Alright, moving up to the crown here. Oh, right there. Okay. Yes, I do feel quite a bump there. Well, that would certainly cause a bad headache, wouldn't it? Not to worry. I have just the thing, right? I'm going to use a little healing device. It's a funny little puff that's going to help massage and also take care of some superficial damage, okay? Just looks like this. Just a cute little puff. I'm just going to use this on the top of your head, and it helps to reduce any sort of superficial damage like bruises or scratches or things like that. So it should help to alleviate the pressure of that bump, okay? Alright, so I'm just going to use this right on that bump. Good. Okay. Is that feeling okay? Good. It should be feeling soothing, not like an irritant. Just a nice, soothing, healing item here. Now, this is something special that you won't find out in the wild. It's something we only have in the Pokémon Center. For just such a case as this. Alright. Do you have any other discomfort on your face or anything like that? Any other abrasions that the healing didn't take care of? Alright, not to worry. I think you're all set. But it is very soothing, isn't it? Wonderful. Okay. Now, if you don't mind, I'd like to just brush your feathers a little bit to make sure that I can see that bump a little bit better. And make sure that it is in fact going down. Alright? Okay. So I'm just going to come and just gently brush here away from the area that had the bump. Good. Yes, it definitely looks much less severe already. That's very good. Now, I'd like to also use these. These are little drops that have some essential oils and other healing properties to them. But this is specifically sort of a massage oil that I can use topically to alleviate tension. Alright? So I'm just going to put a few drops of this on my hands. And then we'll give you a little massage, alright? There we go. Alright, now, if you'll allow me, just going to massage around the bump and try to alleviate some of that tension that might be causing the headache, okay? Okay. There we go. here. It's where we can certainly hold stress and tension, especially after an intense battle. There we are. Is that amount of pressure okay? Good. If I get too hard, please let me know. I'll back off a little bit. But let's just do some nice therapeutic massaging here. Well, to break up that tension for you. To the back of the head a little bit. Is that alright if I massage around the nape of your neck? Alright. Yeah, that can be a spot that definitely holds tension too. We'll just cover all of our bases here. Make sure that you are feeling much more relaxed. That the headache is fully gone. Well, as gone as it can be for a Psyduck, I suppose. There. Now, how does all of that feel? Good. I'm so glad. Well, I do have one other item that we can use if you would like. This is a tool for specifically giving scalp massages. It has all these little prongs, but they're very flexible. I'll just put this right on top of your head and it kind of spreads out. And then moving it just a little bit up and down and twisting it a little bit gives a very gentle but very, very soothing, rather tingly scalp massage. It's a wonderful tool to help relax and to alleviate pain too. And to just help with blood flow, circulation in your scalp, all those kinds of things. Does that sound good? Wonderful. Let me just place that right there. There we are. See, not too uncomfortable, right? Alright. Now, let's just... How does that feel? Good. Yes, this one is very, very relaxing. You're doing a wonderful job. You're certainly looking less in pain than when you came in. Good, I'm so glad. Very glad to hear it. That's what we do here at the Pokémon Center. There. Alright. Yes, that's quite a nice device, isn't it? Definitely very, very soothing. Now, how is your headache feeling after all of those different treatments? Good. I'm so glad to hear that. Well, as your nurse, now I prescribe you to go home, get some rest, maybe light some soothing candles, or have a nice bubbly bath, and let your trainer pamper you for a change, alright? Good. And if ever your headache gets to be too bad, just come right on back. I'm always happy to help here at the Pokémon Center, alright? Alright, well, congratulations again on winning your battle today, and I hope that you have a wonderful chance to rest now. And anytime you need me, I'll be right here at the Pokémon Center. Alright. Okay. Psyduck. Restored full health. Burn. Treatment. And treatment for headache. Good. Alright, who's next? Ooh, an Eevee. Ooh, a little one. That must have been an intense battle, too.